The Vampire Facelift became a viral phenomenon more than 10 years ago and continues to inspire interest. The word vampire is related to the fact that the treatment uses the patient's own blood as the source for platelet-rich plasma, or PRP. Platelet-rich plasma is a concentration of wound healing and growth factors present in the blood that are activated when there is an injury. Platelet-rich plasma was first used by oral surgeons to improve blood supply to the bone for dental implant surgery. Essentially, the key aspects of wound healing, such as the increase in collagen production and new blood supply, is very useful in cosmetic medicine. I found that PRP can also improve skin quality, texture, and thickness. Probably through the stimulation of blood supply, it actually also creates luster to the skin that is unique compared to other treatments. The Vampire Facelift is not just a skin treatment using PRP on its own, although there are practices offering what they call the Vampire Facelift only using PRP injections. The Vampire Facelift is actually a trademarked procedure, and the name can only be legally used by doctors trained and licensed to offer the original Vampire Facelift procedure by its inventor, Dr. Charles Runnels. The real Vampire Facelift, which is what we offer in our practice, uses PRP as well as a single syringe of a hyaluronic acid filler, such as Restylane or Juvederm. Combining the two materials results in a synergistic effect of improving skin quality and subtle improvements in facial volume, as both materials actually work better when combined. The Vampire Facelift is not a replacement for a surgical facelift. It uses the term facelift as it causes the face to push outward, not upward. As we age, there is a gradual loss of facial fat, soft tissue, and bone volume. The filler in the Vampire Facelift procedure provides subtle volume correction in the fat and soft tissue layers between the bone and the skin surface, while PRP improves texture and glow to the skin for a more youthful appearance. Ideal candidates for the Vampire Facelifts are not the same candidates for facelift surgery. Vampire Facelift candidates are usually in their mid-30s and into their 40s who have recently noticed the first early signs of facial aging, such as duller skin and slight facial volume loss. People a little bit older, in their 40s to mid-50s, tend to have lost more bone volume than can be improved with only a single syringe of filler. Candidates for surgical facelifts are people in their mid-50s and older, with far more significant skin and soft tissue laxity. Platelet-rich plasma used in the Vampire Facelift improves the health and texture of the skin and can be repeated at regular intervals for optimal skin quality. Hyaluronic acid fillers are safely metabolized by the body and can also be repeated as needed.